Hello and welcome to Crushing Doubts live Q&A every Monday at 6 p.m. Eastern, 3 p.m. Pacific. I am obviously on location. This is different than what you guys are used to seeing me as, but very happy to be here with you to answer all of your mind-body questions. We'll get right to it in a minute. As usual, I do like to put in a plug for just a couple of my services that can be of particular help. If you're looking for answers that can quickly dial down all of those questions about how to understand the mind-body world in general, my seminars are a great way to get around that. They are designed to shrink everything down and make sure that you understand what's going on in the whole mind-body world. You have too many questions and not enough answers at the same time, and too many answers and not enough answers at the same time. And this will shrink it down into one system that makes sense. So my seminars are really great for that. They're on recording. I do have a live one coming up, so check out our website for that. And as always, I've got the group memberships that can help you with your individual moments to understand your moment-to-moment mind-body experience and figure out what's going on. Get some answers and get some relief. That's what the columns are for. So let's get right to it. A couple of people have joined us, and I want to say hi. We've got Lucy Oden with us, Fruit Loopy, Daniel Starkey, Retrospections Vintage. I'm sorry, Justine, I never say the name right every single time. Catherine Toomer's here with us. It is great to see you here. We've got someone from MFSN, which is actually the sports network that I am affiliated with. So good to see you here, whoever that is, probably Greg. And we've got Jane Smith is with us from YouTube, but we got people coming in from Facebook, Instagram, and YouTube. So let's get right to it. Jane Smith says, "Hi, Dr. Dan. I enjoyed hearing you on Dr. Hanscom's podcast and look forward to part 2. Thank you, Jane. So I did recently go on David Hanscom's podcast. For those of you who don't know David, he's a fantastic guy in multiple ways. But one of the things that I love about David is that he was a back surgeon. And he realized that he was having, first of all, a lot of experiences that really weren't lining up. A lot of the surgeries weren't working. He also was finding that he had to be this kind of person who would shut off his emotions, and he was having all kinds of symptoms. So David is one of these guys who really looked at himself and spent time thinking about what's really going on here. So I give him a huge amount of credit. And David and I had a great discussion. It was on his podcast, and you can get that link from me if you want. You can send me an email, dan@crushingdoubt.org. It's also on our newsletter, so sign up for our newsletter and you will get that notification. Or you can go on Back in Control Radio. You can just search that for the latest episode. And I was on it. And one of the things I talked about that I think is really important is the idea of, are mind-body issues simple or complicated? And we actually talk about that more in part 2. But the lead up to it was very important because David wanted to know more about the nature of my work. And it was fun to see because I think he didn't quite realize how much of my work really is designed to look at the logic of what's going on so that we can actually change thoughts. Because just saying something to ourselves, saying we believe something, it doesn't do us any good. We have to actually believe it. And I think he really seemed to gravitate towards that. So he and I are going to keep tabs and work together in a variety of ways. He does great stuff and is just a great overall guy. So I thank him for having me on. Okay, Suraj Singh is saying hi. Good to see you, Suraj. And we've got a question coming in from Fruit Loopy. Here we go. How do you know if you are more fully embracing the fullness of your trauma and grieving your past versus sinking into an irrational depression that is putting an overly negative, unrealistic skew on past, present, and future? First of all, kudos for phrasing this question in this way, because it's such an important one, and you captured a lot in a small window of space. So well said. I'm going to try to answer it, but as always, guys, my answers are the first answer. What I encourage you is do not stop asking your questions, because it may be that I don't answer it to your full satisfaction. For some people, I might answer your question to their full satisfaction and it really helps them. But if it's not to yours, keep pushing forward. Or if you hear me answer somebody's question and they like the way I answered it, but you haven't gotten your answers, keep it coming. So here's what I'd say for Libby. First of all, figuring out whether you've processed your trauma, it certainly isn't one of the easiest things to do. But I will say this, processing your trauma, if it's done well, what usually it feels like is it feels horrifically hard, but true. And you know it's true. So if you have doubts about whether it's happening, it isn't. And that's the simplest way of putting it, is that doubt gets in the way of processing that trauma. And if you're asking this question, how do you know if you're more fully embracing the fullness of your trauma and grieving your past versus sinking into an irrational depression? What I actually hear in that is a doubt. And of course, as you all know, I'm not critical of any doubts at all. We all have doubts. But part of my job is to shine the light of day on those doubts so that we can kind of take a look at them and figure out what's this doubt saying. So the first thing I would say for Loopy is, let's look at that as a doubt first. Your assumption should be always doubts here first. If you clear away doubt and you get questions like this answered, you can get to a place where you can really see it. But there's a part 2 of this answer. The other thing about processing trauma is there's certain parts of it. There's ways of noting whether it's happening. And one of the main ways that it happens is, are you getting a real full picture of who you are? It's not just about getting in touch with the suffering. It's about integration. It's about feeling that, oh, now I really understand this. So what it should feel like is things are coming together. Things are making more sense. Sometimes it can be really hard, really tough, and in fact, some of the most painful emotional times you could possibly have. But it should feel like things are making more sense. So here's the other interesting part of your question, even though there's lots to it. You're asking this in a dichotomy. How do you know if it's this or it's this? And actually, you've got an in-between thing going on, which is that doubt is layering over the whole thing, and it's not allowing for either one. You do want to make sure that you don't sink into an irrational depression. But one of the ways that you do that in my power column work is the core narrative will keep you on task. If you go back to your core narrative, you'll see if you are saying things to yourself that mirror the suffering that you had. That's more going to be the latter of what you're talking about, sinking into a depression. Whereas if you're seeing yourself more clearly now, and what you're saying to yourself isn't mirroring that old suffering, you're starting to make progress. Ultimately, though, the shortest answer is, are you making more sense to you? So Fruit Loopy, let me know if I answer that question to your satisfaction, and we will go from there. Okay, Karen Isaacs is with us on YouTube. Karen, always good to see you. Karen said, just because I find this funny, it sounds like you had a dream that Putin was going to torture me and friends. When he got to me, he told me he was going to do a lobotomy. I was relieved because I wouldn't know anything. It felt relieving. Wow. Karen, first of all, dreams are very, very powerful and really interesting. But what this is saying to me fits with what we talked about last week and what we've been talking about with you. I tend to get a good bead on certain people if I have any repeated interaction with them. And Karen, the thing that we were talking about is that you've come a very long way in conquering doubt. You've come a very long way in knowing about your emotions column. In fact, with the emotions column, well before you came to see me, and with the doubt column, some with just Sarno, especially level 1 doubt. But we've done a lot of good work on level 2 and 3 doubt, and we're starting to get more into the power column. This dream is a power column dream if I ever heard one. There's multiple ways that a power column dream can happen, but one of them is, I wish I didn't have the mind that I had. In the power column, part of the goal is to get comfortable with the idea of how your mind is and to feel comfortable with who you are. So this dream is actually doubt coming in and saying, Karen, you will never be powerful. You shouldn't be powerful. It's dangerous. You're better off not knowing what's in your mind. So that's how I interpret that dream. But Karen, I want to know what you think, because as always, it doesn't matter what I think. It matters what you think. I do think, though, I'm onto something. So let's think about that. And you tell me what you think. Okay, Jane Smith says, could you please give an example of someone using the emotions column effectively in the moment to resolve a symptom? Do they read through their list of important themes or use specific self-talk? Or so the question really is, it's going to be a very instructive one for many people, Jane. Thank you for asking it. There are many different kinds of examples of this. What I'm going to do first is give you I'll tell you what, I'll give you something that happened to me just recently. So I went to see one of my therapists, and I came out of the session, I love this therapist. She's great. I felt pretty good about it overall, but there were certain things that were, that I was grappling with because I had just gotten through processing a lot of trauma and she hadn't been around as much. And I was kind of worried about opening it up again. And I left that session and I started to have some tightness in my back. Now, I'm really of the believer, I really believe in these columns very much. So the minute there's an onset or an uptick in a symptom, I start to look at the emotions. So I thought, what was going on? And the first thing, Jane, that I do when trying to process an emotions column symptom is to think about the timing. The timing is always exact. So I knew I wasn't having it before session. I only had it afterwards. And then I had it later in the day at certain points, but it really started with the session. So that told me, look there. Now, within that timing, that's where I use my emotions column themes. And really for me, I just kind of use them more generally. I know about them. So I think through what are the major things? Is this a validity issue? Is this about loss? Is this about betrayal? Is this about regret? And I just look for those big ticket items first. I think of it kind of like computer files. You click in the folder for validity, and underneath validity is, were the people who were supposed to care about me, did they care about me? Did they leave me? Did they not give me what I need? And I start looking for things. So I'm trying to give you the best example I can in this, Jane. You're gonna find what I call your system within my system, especially if we work together in the seminars and groups, even just for a little bit of time. You'll figure out how to do this. This all is self-talk, though, by the way. I'm just thinking to myself, what's the timing? What was bothering me? What were the things that happened that could have led to that symptom? What are the things that are typical for me to be upset about that fit with that moment? Meanwhile, I'm sifting through a lot of the things that are going through my mind that are going to cause doubt. Well, maybe it wasn't that. Maybe it happened at lunch later. And I'm like, no, it started right after the session. So pay attention to it. I had another one come up recently. I was just at one of my very best friend's weddings, and I was giving a speech, and I was having pain, but I could not figure out why. So I looked at the timing, and I thought about, okay, what's going on here? And honestly, I actually didn't figure it out until afterwards. The pain, though, drained away when I gave the speech. So I realized there must have been something about that. As I looked at it, and listen, sometimes it's not important whether you get the details or not, but as I thought about it, it was that I was putting so much pressure on myself to give a really good speech because I love him so much and I wanted it to be a great moment for him and his wife. And the speech turned out great. It was a great moment, but the symptoms were saying something to me about it. And I still don't actually totally know what they were saying. So even though I've resolved the symptom, I sometimes go back and look at it because there's information in it. Okay, Jane, those were some examples, but what I want to encourage you is this will get easier over time for you to understand what your process is. Hopefully that gives you some ballpark ideas, though, about the kinds of things that you may need to utilize to look into how to use this. Okay, Christine Sedita, good to see you here. Scotty Stiles, great to see you. And Rody Jangles has joined as well. We've got a couple questions coming in from Catherine Toomer on Instagram. I'm going to read those. Then I see you, Suraj Singh, are next, and Karen will have a follow-up on the power. Okay, so Catherine Toomer says, hi, Dan, happy to be here. It's like a weekly guidepost, helping much of my fear-based doubt turn right back around into excited encouragement. Here's my current state. I often wake up feeling that facing the day will be an uphill battle. I do not sink beneath it, but I do feel like I'm preparing for battle, fighting fear, which shows itself in confusion, perfectionism, self-doubt, joint pain, and fatigue. I'm just keeping my head above water. In between the waves, I do have some beautiful experiences of life. Comments? I think I need to journal more, which always helps, and which I lost track of the sentence there, which always helps and which is all immersed in the columns, I see. I love Fruit Loopy's post and Karen's dream. Okay. Well, first of all, Catherine, thank you for sharing how much it means to be here and how much it helps you. It's wonderful and gratifying to hear. And let me back up and give some comments about this. The way you're describing this, And this is one of the things that I love about the columns is they orient me. When I try to think, well, where am I in this column system? The way that certain symptoms present point me in a given direction. What I was just talking about with Jane, these are emotions column moments, because the rules of the emotions column that I've come to really see I can rely on are these onsets and upticks of sudden things. They relate to an unconscious emotion I wasn't aware of, and I can go looking at it. Whereas something that's really stuck there for a while, I can look at that supposed chronicity and find out about the doubt that's underneath it. Well, Catherine, what you're describing is very, very power column related. When it feels so global and when it infiltrates your whole psychology, what it means to me is you are processing a major trauma. You're in the thick of it. And what I mean by that is not that you're processing major trauma that just happened necessarily, in all likelihood not. What's probably happening is that from going through the column system, which you've been working on and understanding more and more about, you come to understand more about yourself. And as you come to understand more about yourself, you often come up against finding the communication side of the symptoms. So you guys know that I talk about how the symptoms in the emotions column are that distraction that Sarno talked about. It's the symptom is designed to be there so you don't have to be aware of a certain unconscious emotion. In the doubt column, it's simply that the mechanism itself wants to gain ground. It wants to expand its territory so it can keep utilizing itself in any way that it wants. And so it uses doubt to keep that in place. One of the things it tries to keep in place is to keep you from becoming powerful. But as you start to process the fullness of your trauma and you start to figure out who you really are, how all those emotions column moments flow into an overall picture, you start to get a view of you, a global view of you. And that can be very hard. And when you're having that feeling of I'm drowning, it's hard to face any given day. That is definitely a hallmark of you are working through your power column. What I want to encourage you is that won't last. The only way that it does last is if you get scared off by it, because doubt will use that against you to get you confused and think there's no way out and think there's something really bad happening. In my experience, if you stay on this, which I just did recently for a number of months, and I processed a major trauma, and I think I will now feel better about it for the rest of my life. That's usually the way this goes. I'm here to help you with it, by the way, Catherine, so we can touch base about it. But it can be a very rough time when you're first going through processing whatever trauma that you're going through. I have no doubt you've processed trauma before, but there's a specific thing that you're getting in touch with. And I want to find out more about what it is. So that's my first comment on it, Catherine. Let's do a follow-up from there. Let me know what you think about it. Okay. Fruit Loopy says, thanks, Catherine. Dan, for more context, I had an experience which highlighted how alone and unprotected I was as a child. I tried to comfort myself, but I didn't feel like I was strong enough. Okay, so this is Fruit Loopy's question was, am I processing trauma or am I kind of falling into an irrational depression? This to me is her starting to get in touch with kind of the fullness of trauma. And so I would say you are on that former path. You are starting to get to a place where you can understand it. But when you're processing trauma, it's not like in the emotions column where you can get in touch with it and then the symptom vanishes. It's more, you get in touch with it, the symptom doesn't vanish because the communication is still needed. There's something deeper that needs to be understood. So I would say you're doing really, really important work. And if you think about the framework of the columns, it will help you feel that it's not going to last forever, that there's a reason for it, it's headed in the right direction, and you'll keep it up. Fruit Loopy did add, and also I had some doubt if it was really that sad / alone as a kid. Now I just feel very sad, and I don't know if I'm making progress on the trauma at all. Thanks, Sarah. So you are making progress, Sarah. In the interactions we've had, it feels to me like we're headed there. There's a way in which you do not have an easy time being empathic to yourself, which, big hugs to you about that, because that's a really hard thing. You just haven't gotten that care. I think that's doubt coming in to keep you from becoming powerful. And remember, your core narrative isn't everything that you are. You may not have felt sad and alone as a kid in every way, but there are ways in which you really did, and this is legitimate. So use black and white thinking, dip into it, and let yourself see this is part of your reality. This is part of what you suffered. And I want you to really see it and take some time and be kind to yourself and know that I'm here with you. Let's keep talking about it, Sarah, but I will say this. You are making that progress. That's exactly what I would want to be seeing, even though I know it's so painful, because it's going to lead to progress and it's going to lead to a lot of relief. So we will keep it up. Okay, Suraj Singh, thank you for your patience. Suraj says, hi, Dan. Do you think our nervous system can create chronic intense sensations, intense burning and pins and needles, thorns in my knees, 10 out of 10 pain? Similar to chronic pain, I cannot stand or walk 1 minute. There's a little bit of follow-up, so I'm going to read through the whole thing and then I'll answer that question. I went to a few therapists and doctors and they think it is TMS and extremely severe, but they were not 100% sure. Have you seen similar sensations in other patients? And if they are TMS, why no tool and techniques like curable, PRT, et cetera, have worked on it for months? Can you please help me? Okay, Suraj, I can definitely help you. I'm going to give you my answers. As always, guys, my answers don't matter as much as what my answers mean to you and whether they get your question settled. So Suraj, push back if I don't answer your question enough. What you are describing is 100% TMS. If it was some other greater issue medically, doctors would have found it. This is one thing that I do rely on doctors a lot for. They're actually very good at finding serious problems. The problem is they sometimes call certain things serious problems when they aren't, like a herniated disc. That's not a problem. However, a lot of the things that they do identify as very serious, I shouldn't say a lot of them, but there is a handful that are. They're always life or death, though. They're always really big deals, or they relate to a catastrophic and obvious injury that happened right at the time. And even those generally totally heal. So what you're describing to me is 100% TMS. Sometimes it's hard for me to understand why people are so shy about labeling it TMS. I am very careful to say, listen, get checked out by a doctor. If you hadn't been to a doctor, I'd say, hey, go get that checked out, because I'm not a medical doctor and I don't know. Very important that we do that. But once you've done that, then we can start to look at, does this have all the hallmarks of TMS? And it does. Part of the hallmark is how intense it is. The more painful it is, the more likely it is to be TMS. The most painful symptoms I've ever had by a factor of 10 are mind-body related. In addition, I have heard of people with these specific symptoms. I've even had these specific symptoms. One time my brother and I were joking because I had started getting him to understand these things, and I had gotten rid of his back pain, and suddenly he described that it felt like a burning hot coin was on his thigh. I mean, these symptoms can be really strange seeming, but it's because the peptides, the messengers of the brain that can go to any cell in the body, can create any symptom that can happen. So are these symptoms possible? 100%. Now, that answers your first question. Is it, likely to be a TMS, and can it be created that way? Answer to that is yes. Now, the second question, have I seen similar sensations? The answer to that is yes. But your third question is also an important one. And that is, why are there no tools and techniques like this? Okay. So I don't totally know the answer to that, but I think I have a good beat on it. And it's this. I find that in our society, people are very afraid to be definitive. There is a value on not being definitive. There's a value on being overly cautious. What people don't realize is the danger that poses for the people they work with, because it breeds doubt. One of the things that I loved about Dr. Sarno, and I took away from him, is not just what he was saying, but how he said it, his way, his ability to be certain about things. That's part of why I got better. So I'm not just saying, let's just be certain just to be certain. But if we are looking at things and they all add up, then why not be certain? So everything you're saying to me definitely fits with it. So why no tools and techniques like this? I think that they feel more comfortable falling back on people like Dr. Sarno or people like Howard Schubiner, who are these great doctors in the field. So with back pain, for example, we have no problem falling back on that. There's tons of journal articles on these things. There's tons of backup about it. So they tend, these like Curable and all these different groups, they tend to rely on the things they know. One of the ways that I'm different is I don't see any symptoms as different. I mean, look, you got to get them checked out by a medical doctor, but the reality is you can get to a place where you've been checked out, and this happens very frequently, where people know I've been checked out. So the real question is this: is the brain capable of creating all of these different kinds of symptoms? And the answer is yes. So why aren't we treating it the same way? Suraj, with respect to how I do things, I actually would, if you came to me, I would have tools and techniques that are just like this. And you know why? Because it works exactly the same. The one thing that's probably going to be different is there's a little more doubt built in, because you don't have the entire mind-body community saying, yes, that's what it is. I'll guarantee you it's that. And let's connect. Or write me at dan@crushingdoubt.org, and we'll, get set up to talk about these symptoms and go from there. Okay, now Karen Isaacs, as a follow-up to our power discussion, says, yes, I'm really integrating quote unquote power. When I first found you, I was intimidated by the columns. Now, though, it makes so much sense. And yes, what you say about dreams feels right on. Gonna think on this and pipe back in. Okay, Karen, that's great. I want to highlight one thing that Karen said that I think is really important here. And that is that people can feel intimidated by the columns, but I'm finding more and more that there's a very helpful way of thinking about it. And it's this, that the columns are actually very simple in their overall nature and in how they operate. They have a very clear set of principles. And I'm going to say it right now. I've boiled it down to this. The emotions column is for the onset and uptick in symptoms. It alleviates acute symptoms by unearthing unconscious emotions that are leading to the symptoms. Once the function's gone, the symptom's gone. The doubt column is for supposedly chronic symptoms. When your thinking is in the same place, your physiology is in the same place, you change your thinking with true belief from science and logic, and your physiology changes. That's it for the doubt column. When it comes to the power column, it is about your relationship with yourself. And in looking at what your core suffering self experienced, you can understand you, receive the communication of the symptoms, and then the function of the symptoms is gone also. So each column represents a kind of mind-body experience. And when the function of the symptoms taken away, then the symptom doesn't need to be there anymore. So I just was able to sum up the entire column system, and I'm getting better at doing that, which is helpful for people. Even in my book, I'm finding, this book needs to hone in more on that idea, because I've got some ideas they're great ideas and they can help with specific things. But if I put them all out there all at once, it can feel intimidating. Always return to the basic function of the columns. And Karen, I think by doing that in the work that we've been doing, you are starting to integrate the idea of power. It's becoming not so abstract. It's becoming easier and easier to see. And then we fill in the details as we go. So keep up the good work. I'm glad to hear it. Okay. Let's see. We've got Sophie Diaz has joined us on Instagram. Good to see you. Laura Court, good to see you again. Been a little while, but good to see you. And Michelle, great to see you. Okay, we've got a couple questions coming in. Justine, I'm going to get to you on Instagram in a second, but Donnie Harn has a question on YouTube. And Donnie, by the way, I owe you an email or two, so I'm getting back to you. Sorry, I'm slow on email, guys. And if you are sending emails to me, just a little shout out. Even if you send me multiple short ones, you'll hear back from me faster because I can get back to you on one or two quickly. So Donnie, you say, hey, Dan, I've started to have a decrease in shift in symptoms after working the emotions column the past couple of days, although I still have a lingering small doubt. What direction should I go here? Okay, first, let's acknowledge our wins. Donnie, if you are getting the hang of even one of the columns and it's starting to help, this is a tool that you're going to have for the rest of your life. And you're going to be able to hone that. So what we want to do is to keep doing that. So first thing is the emotions column is working. You said, I have a lingering doubt. So listen, to get these columns to work, we need to know what the emotional experience is like and get to a place where those emotions can be paired with a symptom so that we can control them. But when doubt is there, we get all thrown off. Now let's remember the four forms of doubt. There's fear, confusion, a general lack of certainty, and questions. When you say there's a small doubt, what that tells me is we've already gotten past fear. your doubt's not so big that it's running all that rampant. We're even past confusion because you're telling me something's making sense. Confusion is when really almost nothing's making sense. So now we're dealing with either you've got a lack of certainty or you have questions that are still lingering. So what we need to do essentially is do the work of the doubt column. You're making progress in the emotions column. Now let's do the work in the doubt column. Essentially, we need to, here's what we do in the doubt column: observe, articulate, and counter. So what I'd like you to do, you've observed that there's a doubt. You know it's there. Your next step, articulate. Put into words, what is this doubt? When you say, what direction should I go here? Of course, you're going to ask that. Articulate that doubt. If we can articulate the doubt and then figure out what is the answer to that with science and logic, answer it to your satisfaction, that doubt's going to come down and it's going to clear out even more space to make progress. So Donnie, let me know if that makes sense to you, okay? All right. Jane Smith says, thanks so much, Dr. Dan. Really helpful to hear your very specific examples, and I will keep working on this. Very much appreciate your generosity. My pleasure, Jane. I'm always happy to provide. I have tons and tons of examples. Some of them are from my own life. Some of them are from other people who have given me permission to share them, or I'll share them in a very disguised way. But, and listen, Dr. Sarno explains it as well. There's lots of places you can find these things, but the key is to understand it. So ask your questions, get your questions answered. And Jane, I'm so glad you asked that and that it was helpful, my answer. Okay, Justine, thank you for your patience. It's funny, I was just trying to move my computer screen, but actually Instagram's on my phone right now, so that wasn't gonna work. Okay, Justine says this. Hi, Dan, I've missed a couple of weeks and glad to be back. I am processing lots of childhood attachment trauma related to my mother, who is still living. I have found good progress and changes in myself after a really rough time, being honest about it all. My conditioned responses / triggers, though, have increased, and I fight the doubt, but it's feeling harder since the emotional progression, particularly cyclical hormonal triggers that I tell myself aren't necessary, yet it feels so deeply ingrained. Okay, so Justine, there's a lot going on in what you're saying here, and I want to make sure that I do it justice. I'm going to answer it, and then I want you to kind of sort through what did I miss? Because as always, it doesn't matter what I think. It matters whether what I'm saying to you addresses your question. So I'm hearing some questions in the background of this, and I want to make sure that I have the right idea. You please tell me if I don't have it right. What I'm hearing is that you have much more awareness now as you're going into these situations with your mom. She's still alive, so it's a live event. And listen, that can happen even with dead parents because you're still living a life with that relationship in your mind. But now you're dealing with a living human being, and you're saying, I found good progress and changes in myself after a rough time, being honest about it all. In the power column, it is incredibly important that we are honest with ourselves. But one caveat, sometimes we think we're being honest with ourselves when really we're just attacking ourselves. Being honest with yourself, sometimes it can hurt, but the question isn't whether it hurts ultimately, especially not at first. The question is whether it feels true. And it sounds like you've been doing some very good work with things that feel true. So that's been progress. What you then said is my conditioned responses, though, have increased. Well, that can definitely happen. What this is suggesting to me, Justine, is that we need some action steps. We're getting clarity. You know, every column is about understanding the nature of the problem, seeing things more clearly, and then making a choice. So in my book, I describe the columns and what their functions are, but then I describe action steps and the function of action steps and how we choose them. We determine what column we're working in. We find the broad theme within that column. We find the specific problem. And then we start to think, what do we need to do about this? That's where you're at here, Justine. And I think a lot of times people run into trouble, and doubt loves to capitalize on this. It loves to tell you, well, there's no way around this. It can get you confused again. What I want to encourage you is there is a way around it. You may need a little bit of interfacing with me or one of my trained therapists who understands the column system, just to give you some ideas about this. And the good news is that can be short term. A lot of what I've designed is cost effective because it's short term. The idea is, well, it's short term or it's long term, but in a way like in the group membership where it's so cost effective, you could keep it going for as long as you need. I like to build things that work. And these systems do work for multiple reasons. But one of them is they give you the space in a cost effective way to get actual suggestions about what to do. So I'm going to give you an example, Justine. I don't know if it applies to what's going on for you, but you did describe this one specific thing, so I wanted to respond to it. You said, particularly cyclical hormonal triggers that I tell myself aren't necessary, yet it feels so deeply ingrained. I actually wanted to ask a question about that, because that to me feels like there's some doubt-related thing. But you were saying that your conditioned responses and triggers have increased. So I just want to make sure I'm understanding it. What I'm understanding is you've done the power column work. But as is often typical, doubt has come crashing in to try to prevent you from feeling fully powerful and enjoying it. The triggers have gone up, the doubt's gone up. And in specific, there's this cyclical hormonal triggers that are making you feel like this is deeply ingrained. I don't know if I can do that. So remember in the doubt column, because we're looking for an action step. You've done a lot of great power column work. We don't need a power column action step because that's not where the problem is. We're going to locate the column. It's in the doubt column. So within the doubt column, you've identified the specific thing and you're observing that it's doubt. Remember, observe, articulate, and counter. Well, now we need to get this articulated. This is similar to what Donnie asked. We've got to get that question out in words. What is it that you're actually saying to yourself? Why does the cyclical or hormonal trigger speak to you the way it does? What are you saying to yourself about it? As an example, I don't know if this is right, Justine, but it could be that you're thinking, listen, I really believe in mind body, but some things are just bodily. There's just nothing to it. And, it comes in cycles. So the fact that there's that pattern, it means it can't be mind body. Okay, I don't know if that's the case, but if that's the doubt you articulated, then we can counter that by saying, but the mind body process is very smart. It can mimic anything. So if it knows that cyclical issues are the thing that gets you, it can behave cyclically. So it does not rule out that this is mind body. And we need to start looking at it. But the main thing, Justine, is let's get that articulated so that we can get some countering of that. Okay? All right. Fearless Tony has joined us. Mary Sue CM is here. Good to see you as well. Let me see if anybody else joined us here that I miss. No, I got everybody. Okay. A couple of questions from YouTube. Then I will get back to some questions coming in from Instagram. Okay. Suraj Singh with a follow-up. I went to orthopedic doctors and they were not able to find anything serious other than some degenerations in the knees. We know degenerative stuff is never the cause of these things. I've lost my mobility 100%. They are so intense and they go to my feet sometimes. So Suraj, first of all, a huge amount of empathy for you. Being crippled is hard, but the good news is mind-body issues, nothing is chronic. Nothing is structural. We can get rid of this. So Suraj says, I will reach out to you as I've lost my life. Thank you, Dr. Dan. We can reclaim this and we can reclaim it fast, Suraj. So please do. This is one of those times where if you're ever in that kind of space, please do reach out to me. It's dan@crushingdoubt.org. I can help you get your life back very, very quickly. Donnie Harn says, thanks, Dan. No worries about the emails. No rush. Thanks so much. This makes sense. I actually just started the doubt column seminar video today. My doubts should be cleared up easily. Then I need to accept them. So Donnie, you're making great progress. Donnie, by the way, is watching the seminars on video. Some people, it's easier on their schedule or there isn't a live seminar. We just finished one last week, but there's one coming up. There's always one coming up pretty soon. So check on the website and you can see when. But so far, Donnie, it seems like you're getting a lot out of these videos. They consolidate information. They make it clearer. For some people, they get overwhelmed and they think they're not going to get it. But I do a lot of things in these seminars that also simplify, even for them, where I say, wait. All we need to do is get the function of the columns, and then we expand from there. So you're doing great work. You're moving into the doubt column work now, and we'll just keep me posted. You're doing great work. I'm very excited about where it's going. Keep it up. Okay, Catherine Toomer says, I realize I'm afraid to look back at what the specific trauma is. But that is just how I felt before I really examined the source of my wrong place, wrong time feeling when I faced it head on and in. So, Catherine, it does obviously take some bravery to go ahead and dive in and look at these things. but I applaud you because you're squaring it up. And that's what the power column work is we say to ourselves, you know what? I don't like these symptoms. I don't like being stuck in the same position. Let me look at the reality. No matter how painful it might be, I'd rather see it. And luckily in the power column, you see it, but you also get to a place where you can do things about it and understand yourself better, and you get a lot out of it. Michelle said, can we add a follow-up to the conversation about FOMO, fear of missing out? I'm just recognizing that this is a trauma response for me. So yes, we talked about that in the group today. Really important stuff, because fear of missing out in a way is basically saying, I've done something wrong. I missed something. I've lost something. I can't get something. It's all a self-attack. And I agree, Michelle, I think that's a trauma response for you. It's interesting. It related to what Catherine was just saying, wrong place, wrong time. So many of us think we're in the wrong place and we did something wrong and we wish it was different. But in the power column, one of the things that helps is recognizing that you are who you are for a reason. And that means a lot of the things that you do in response are the things you need to do and the places you need to be. And in the power column, we actually come to appreciate the journey we are on. It's easier said than done a lot of the time, but we will keep doing the work. And people in the groups are making huge progress. People are getting a lot of the seminars for it. Even here, we're getting a lot of great work done in these Q&As as we talk about these things. So Michelle, yes, let's do a follow-up about that, okay? We'll keep it in mind as well. All right, Daniel Starkey says, where do physical triggers around movement fit in your columns? If moving/lifting causes flare-ups of pain, is that emotional still or is that doubt? Okay, Daniel, that is straight in the doubt column. That is a trigger. Now, that's the one example of an onset of a symptom that doesn't have to be emotional. It can be purely cognitive because your body knows you just did something and doubt wants to capitalize somewhere, and it's going to capitalize on those movements. So that's doubt. And what we want to do is recognize what is the doubt, and we want to be actively challenging it. So I often tell myself, nope, I can do that movement. That's not a problem. It might hurt, but it's not going to harm me. Lots to say about that, Daniel, but it's doubt column all the way. Let's do a follow-up on that as needed. Okay, let's see. Catherine, you were saying, when I faced it head on and in detail, I see. It was resolved rather readily. So that is a pep talk to myself. I will go to a quiet space and really be open to facing the trauma as I meditate and write. Yes, Catherine, one way to not be afraid of the trauma is to remember it's trying to communicate something to you. And that communication isn't bad. It could hurt, but even that, it can hurt, but it's not going to harm. The opposite, it's going to set you free. The symptoms want you to know this. They're not going to give up until you get that communication. So let's go get it. Justine says, yes, feels like you are saying it has gone back from power to doubt. Absolutely. You did the power column work. Doubt came crashing in. She says, you're right. I've never not had cyclical issues. So there is deep doubt about that as something different to the rest, which I can now work on. Great. She says, thank you. That's great, Justine. So these are the kinds of things that we can now expand because we're seeing the doubt. And that's the important thing about doubt. Observe it. Don't let it get away with it. It hides in plain sight, and then it can just rule the roost for the rest of the time, for years sometimes, if it doesn't get exposed. But if it's exposed, it will not stay. Okay, Michelle, I see you say, yes, please, thanks. I will. So yes, we'll keep in mind that FOMO idea. I thought that was really an important discussion today, and I was glad you were part of it. Okay, Daniel Starkey with a follow-up. So the trigger is a learned association, and it's actually a learned doubt because your mind has learned to fear that movement based on past pain. Yes, and not only that, your mind has learned, the doubt part of your mind has learned to manufacture that symptom when you do move to reinforce that. So it ends up being a vicious cycle where you're like, well, see, when I moved, it did hurt. What you have to remember is to entertain the idea that you don't know why it hurt. It could be that there's an injury, but highly unlikely. It could be that it's a mind-body cycle that leads to the triggering experience. Then Daniel says, it seems like the way out is to constantly be conquering a little doubt, becoming a bit more powerful, then conquering a little more doubt, becoming more powerful, et cetera, et cetera. Beautifully said, Daniel. Yes, I say about doubt, it's step by step. When you take apart one doubt, all the other doubts weaken. When you grow a little bit in power, you gain the ability to believe you can grow more in power. It is step by step. I tell people, don't think in results-oriented thinking. Am I there yet? Think, am I understanding things more? Am I able to do some more things that I couldn't do before? Have I made little gains? And sometimes those little gains are just in understanding. So you've got the right idea and you're on your way. Let me know if I can be of further help. Okay, we're going to need to finish up on this tonight, guys. Rhonda Johnson, good to see you here on YouTube. Let me just make sure I didn't miss anybody on Instagram. Okay, good. So Rhonda says, hi, Dr. Dan. I've been doing power column work and was making progress. Yesterday, I was driving and clipped a construction cone with my side view mirror. It broke my mirror, and I have been out of sorts today. I'm having pain that keeps moving around. I haven't been afraid of pain, but doubt and fear is trying to tell me that the slight impact caused some kind of problem with my body. I'm just struggling with the fear of the pain, and it is troublesome. Okay. So we'll finish up on this, guys. And then I do want to remind you, I'm not here next week for the Q&A. Then I'm back for the foreseeable future. So I should be here most Mondays, but not next week. Just a reminder about that. So Rhonda, here's what happened here. We're just starting in on the power column work in some ways. Yes, you and I did the core narrative originally, a while back, but you're really diving into it now. And this is the kind of thing that doubt does. It'll capitalize on anything. And it has so many opportunities. So you clipped a construction cone and then you got sort of worried about something. This is a classic. And I don't mean that as dismissively. I mean it empathically. Doubt attaches to whatever it can. And it can attach to almost anything convincingly. And actually, the smarter you are, the more active your doubt can be and the more kinds of things it can attach to. And that's what happened here. So what I want you to remember is this is just doubt. This is just EMS. There is 100% nothing wrong with you. Sometimes you're going to need to return to the doubt column to do that work, and then you'll go back to doing that power column work. At base, though, if doubt is there, attack the doubt. If doubt is there, it is the primary column, always. Deal with the doubt first, unless there's a very acute situation, in which case you go to the emotions column. But most of the time, get rid of the doubt first, or at least get it under control enough that you can use the rest of the columns. Rhonda, do let me know if that helps, but of course, we'll be in touch and I can help you one way or another. These columns continue to map out what's going on very easily. I can interpret them for you and I can give you ideas about what to do. Okay, Karen Isaacs, we're going to squeeze in one last thing because you have a follow-up here. I think the only reason I was intimidated by the columns was because it was when I still felt desperate to be fixed. I had only been listening to Nicole for a couple of months and anyone new felt overwhelming. Okay, that makes a lot of sense. It looks like you were still in the middle of saying the rest of that, Karen, but I'll wait for the rest of your statement. But, I know you were drawn to what I was saying. And I think in a lot of ways, what I've said has dovetailed with a lot of what Nicole says, not surprisingly. In the mind-body community, we agree on lots of things. Sometimes we're saying certain similar things in a different way. What I do love about my columns, though, is it helps to organize not just what I say, but what they say as well. So it gives you a framework to understand it all. And that makes sense. When you're desperate, you're going to feel more intimidated, more overwhelmed. Doubt has more room to pounce. But the columns organize it. They shrink our fear. They make the confusion less. They slowly move that doubt more towards just a lack of certainty or maybe just questions. And it calms it all down. And like Daniel was saying, little by little, we take apart one doubt and it gets easier. We become a little more powerful. It becomes easier. These columns build upon themselves. So let's keep it up, guys. Once again, please don't be shy about reaching out to me. It's dan@crushingdoubt.org. I'm happy to help you all. I've got lots of resources. My systems are very well built now. When I first started this out, it was overwhelming because I didn't have them built out enough. I had to build out lots of systems. I've got that now. I even have trainings, meaning if you want to do this work and help other people, you can reach out to me with that as well. I've got another training coming up at the beginning of the fall. So if that's of interest to you, please do let me know. The seminars are available. The groups are available. The book is in process. A lot of good editing going on and hoping to get that out to you in the late fall. So I will keep updates coming. And it is a pleasure talking with you all. You're a wonderful community. And I'm so gratified that I'm able to help many of you with these issues, understanding them. Don't hesitate to contact me as needed. Okay, guys, I will see you in 2 weeks for the Q&A. There still will be podcasts coming out throughout, and I'm still reachable. So let me know if you need my help, and I'm here. Thanks so much.